Question 1. Market research demonstrates that registered drama therapists, RDT, are increasingly incorporating puppetry and object work into their practice, particularly with children and adolescents. An RDT is considering using a handcrafted puppet with a client who has a history of attachment difficulties and exhibits some anxiety around new social interactions. The RDT has a personal connection to the style of this particular puppet. What is the most ethically sound and professionally responsible approach to integrating this puppet into therapy? Option A. Immediately introduce the puppet to the client, as its novelty and the therapist's enthusiasm are likely to engage the client and reduce anxiety. Option B. Conduct a thorough risk assessment of the puppet's potential impact on the client, considering their specific history and therapeutic goals, and consult with a supervisor regarding its use. Option C. Utilize the puppet, as the therapist's personal connection to it will foster a sense of authenticity and rapport with the client. Option D. Avoid using any puppets or objects, as the potential for triggering past trauma or creating transference issues is too high with this client population. Correct answer is B. Conduct a thorough risk assessment of the puppet's potential impact on the client, considering their specific history and therapeutic goals, and consult with a supervisor regarding its use. Explanation. This scenario presents a professional challenge for a registered drama therapist, RDT, due to the inherent risks associated with using puppetry and object work with vulnerable populations. The RDT must balance the therapeutic potential of these modalities with the need to ensure client safety and maintain professional boundaries. Careful judgment is required to assess the suitability of the chosen objects, the client's capacity to engage safely, and the potential for unintended transference or countertransference. The correct approach represents best professional practice because it prioritizes a thorough risk assessment informed by the client's individual needs and the specific therapeutic goals. This aligns with the RDT's ethical obligation to do no harm and to practice within their scope of competence. By consulting with supervisors and considering the client's history and current presentation, the RDT demonstrates due diligence in anticipating and mitigating potential risks. This proactive approach ensures that the use of puppetry and object work is a deliberate and ethically sound therapeutic intervention, rather than an impulsive or potentially harmful one. An incorrect approach that involves immediately introducing a potentially evocative object without prior assessment fails to uphold the RDT's ethical duty of care. This could lead to unintended emotional distress for the client, especially if the object triggers past trauma or overwhelms their coping mechanisms. Such an action would be a regulatory and ethical failure, as it bypasses the necessary due diligence required to ensure client safety and well-being. Another incorrect approach, which is to avoid puppetry and object work entirely due to a generalized fear of risk, represents a failure to utilize a potentially valuable therapeutic tool. While caution is necessary, an outright avoidance without a specific, documented rationale based on the client's needs or contraindications could limit therapeutic efficacy and fail to meet the client's potential needs for creative expression and exploration through these modalities. This could be seen as a failure to competently employ the full range of RDT interventions. A further incorrect approach, which is to use objects that are personally significant to the therapist without considering their potential impact on the client, constitutes a significant ethical breach. This blurs professional boundaries and introduces the therapist's own material into the therapeutic space, potentially leading to transference issues and compromising the client's autonomy and the integrity of the therapeutic relationship. This is a direct violation of ethical guidelines regarding professional boundaries and self-disclosure. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the client's presenting issues, developmental stage, and any known sensitivities or trauma history. This should be followed by a careful consideration of the therapeutic goals and how puppetry or object work might serve those goals. A thorough risk assessment of the chosen objects, including their symbolic meaning and potential for eliciting strong emotional responses, is crucial. Consultation with supervisors or peers, especially when dealing with novel or potentially high-risk interventions, is a vital component of ethical practice. Finally, ongoing monitoring of the client's response and flexibility in adapting or discontinuing the intervention as needed are essential for maintaining a safe and effective therapeutic process. Question 2. The evaluation methodology shows a therapist considering the most appropriate way to assess a client's progress in a drama therapy group focused on social anxiety. The therapist is weighing the benefits of a standardized, quantitative behavioral checklist against a qualitative approach involving client narrative reflection and therapist observation of group interaction. Which of the following assessment strategies best aligns with the principles of comprehensive and ethical drama therapy practice? Option A. Relying exclusively on a pre- and post-intervention standardized anxiety symptom checklist administered without further discussion or qualitative feedback. Option B. Utilizing a newly developed, unvalidated assessment tool that claims to measure creative expression without clear operational definitions or client consent for its specific use. Option C. Focusing solely on the number of times a client participates verbally in group sessions as the primary indicator of progress. Option D. Employing a combination of client self-report measures, therapist observational notes, and analysis of creative artifacts produced during sessions, ensuring all methods are explained to the client. The correct answer is D. Employing a combination of client self-report measures, therapist observational notes, and analysis of creative artifacts produced during sessions, ensuring all methods are explained to the client. Explanation. The evaluation methodology shows a common challenge in drama therapy, balancing the need for standardized, measurable outcomes with the inherently subjective and process-oriented nature of therapeutic engagement. The registered drama therapist, RDT, must select assessment tools that are both clinically relevant and ethically sound, adhering to the standards set by the North American Drama Therapy Association, NADTA, Code of Ethics. This scenario requires careful judgment to ensure that the chosen assessment method accurately reflects client progress without oversimplifying or misrepresenting the therapeutic experience, and without compromising client confidentiality or informed consent. The correct approach involves utilizing a multimodal assessment strategy that integrates both qualitative and quantitative data, aligning with best practices in RDT assessment. This approach respects the complexity of drama therapy by incorporating client self-report, therapist observation, and potentially creative output analysis. It allows for a more holistic understanding of client growth, acknowledging both observable behavioral changes and internal subjective experiences. This aligns with the NADTA Code of Ethics' emphasis on client well-being, competence, and responsible practice, particularly regarding accurate representation of services and outcomes. An incorrect approach would be to rely solely on a single, highly quantitative, and decontextualized measure, such as a standardized behavioral checklist, administered without accompanying qualitative data or client input. This fails to capture the nuances of the drama therapy process and may lead to an incomplete or inaccurate assessment of client progress. Ethically, this could violate the principle of competence by not employing methods appropriate to the modality and could misrepresent the effectiveness of the therapy. Another incorrect approach would be to use an assessment tool that has not been validated for use with the specific client population or in a drama therapy context, or one that has not been explained to the client with full transparency regarding its purpose and limitations. This raises concerns about competence and informed consent, as clients may not understand what is being measured or how the data will be used. It also risks misinterpreting findings due to the tool's lack of suitability. A third incorrect approach would be to prioritize the collection of data for research or program evaluation over the immediate therapeutic needs and comfort of the client, without explicit, informed consent for such data collection. This could breach confidentiality and trust, undermining the therapeutic relationship and potentially violating ethical guidelines regarding client privacy and the responsible use of therapeutic data. The professional decision-making process should involve a thorough understanding of the client's goals, the specific therapeutic interventions being used, and the limitations and strengths of various assessment tools. It requires ongoing reflection on the ethical implications of data collection and a commitment to using assessment as a tool to enhance, rather than dictate, the therapeutic process, always prioritizing client welfare and informed participation. Question 3. Quality control measures reveal that a registered drama therapist, RDT, has observed a client's parent attending a community event where the therapist was also present, and the therapist recognizes this parent as a former acquaintance from outside of professional practice. The therapist is concerned about how this recognition might impact the ongoing therapeutic relationship with the client. What is the most ethically sound course of action for the RDT? Option A. The RDT should schedule a session with the client to discuss the observation, explore the client's awareness and feelings about the potential connection, and collaboratively assess any impact on the therapeutic process, while remaining open to modifying the treatment plan or referring if necessary. Option B. The RDT should immediately terminate the therapeutic relationship with the client to avoid any perceived or actual conflict of interest arising from the acquaintance. Option C. The RDT should continue with therapy as usual, assuming the client is unaware of the therapist's acquaintance and that the professional relationship will not be affected by this external connection. Option D. The RDT should discreetly inquire about the parent from the client's family member to gather more information about their relationship before deciding on a course of action. The correct answer is A. The RDT should schedule a session with the client to discuss the observation, explore the client's awareness and feelings about the potential connection, and collaboratively assess any impact on the therapeutic process, while remaining open to modifying the treatment plan or referring if necessary. Explanation. Scenario analysis. This scenario presents a common ethical challenge in drama therapy where a therapist's personal relationship with a client's family member could potentially compromise the therapeutic relationship and the client's well-being. The core challenge lies in balancing professional boundaries with personal connections, ensuring that the client's best interests remain paramount and that the therapeutic process is not inadvertently influenced by external factors. Maintaining objectivity and avoiding dual relationships is crucial for fostering trust and effective therapeutic outcomes. Correct approach analysis. The correct approach prioritizes the client's welfare and upholds the ethical principles of drama therapy by proactively addressing the potential conflict of interest. This involves open communication with the client about the observed relationship and exploring the client's feelings and perceptions regarding it. It also necessitates a thorough assessment of the potential impact on the therapeutic alliance and a willingness to modify the therapeutic plan or even refer the client if the dual relationship poses an unacceptable risk to the client's progress or confidentiality. This aligns with ethical guidelines that mandate therapists to avoid relationships that could impair their professional judgment or exploit the client. Incorrect approaches analysis. One incorrect approach involves continuing the therapy without acknowledging the observed relationship. This fails to uphold the ethical duty of care and transparency. It risks undermining the client's trust, as the therapist is aware of a potential conflict that is not being addressed, which could lead to perceived bias or compromise confidentiality. This violates the principle of informed consent and the therapist's responsibility to manage dual relationships ethically. Another incorrect approach is to immediately terminate therapy solely based on the observed relationship without any discussion or assessment. A referral might be necessary. An abrupt termination without exploring the client's perspective or assessing the actual impact of the relationship can be detrimental to the client's therapeutic journey. It fails to demonstrate due diligence in exploring less restrictive interventions and can be perceived as abandonment, violating ethical mandates to provide continuity of care where possible. A third incorrect approach is to discuss the observed relationship with the family member without the client's explicit consent. This constitutes a serious breach of confidentiality and professional boundaries. It directly violates ethical codes that protect client privacy and require informed consent for any disclosure of client information, even to those with whom the therapist may have a personal connection. Professional reasoning. Professionals should employ a decision-making framework that begins with identifying potential ethical conflicts. This involves recognizing situations that could lead to dual relationships or impair professional judgment. The next step is to consult relevant ethical codes and guidelines specific to their profession. A thorough assessment of the potential risks and benefits to the client is paramount. Open and honest communication with the client, where appropriate and ethically permissible, is crucial for informed decision-making. When conflicts cannot be adequately managed to protect the client's welfare, seeking supervision or consultation from peers or professional bodies is essential, and referral should be considered as a last resort if the therapeutic relationship cannot be maintained ethically. Question 4. The monitoring system demonstrates a significant improvement in client self-esteem scores following a series of drama therapy sessions, as measured by a standardized psychometric instrument. However, the therapist's qualitative observations and client self-reports suggests that the primary therapeutic gains were in areas of interpersonal communication and emotional regulation, which are not fully captured by the chosen self-esteem measure. The RDT is preparing a report for stakeholders on the effectiveness of their program. Which of the following approaches to reporting these outcomes best aligns with ethical and professional standards for registered drama therapists? Option A. Focus the report solely on the qualitative observations of improved interpersonal communication and emotional regulation, omitting the standardized self-esteem scores to avoid presenting potentially misleading data. Option B. Present the standardized self-esteem scores as the primary evidence of success, while briefly mentioning that other qualitative gains were observed but not formally measured. Option C. Report the standardized self-esteem scores, but also include a detailed qualitative analysis of observed improvements in interpersonal communication and emotional regulation, supported by anonymized client testimonials and therapist notes, explaining how these qualitative findings provide a more comprehensive picture of therapeutic impact. Option D. Disclose the anonymized client testimonials and therapist notes to illustrate the qualitative gains, alongside the standardized self-esteem scores, without explicitly seeking additional consent for this specific reporting purpose, assuming general consent for program evaluation was obtained. The correct answer is B. Present the standardized self-esteem scores as the primary evidence of success, while briefly mentioning that other qualitative gains were observed but not formally measured. Explanation. This scenario presents a professional challenge because it requires balancing the need for objective evaluation of therapeutic outcomes with the inherent subjectivity and relational dynamics of drama therapy. The registered drama therapist, RDT, must navigate the ethical imperative to demonstrate efficacy while respecting client confidentiality, autonomy, and the qualitative nature of therapeutic progress. The pressure to present quantifiable data can conflict with the nuanced, process-oriented nature of drama therapy, where progress may not always be easily translated into numerical metrics. Careful judgment is required to select evaluation methods that are both ethically sound and therapeutically appropriate. The correct approach represents best professional practice because it prioritizes client well-being and ethical data collection. It acknowledges the limitations of purely quantitative measures in capturing the full spectrum of therapeutic change within drama therapy. By integrating multiple data sources, including qualitative client feedback and therapist observations, it offers a more holistic and authentic representation of outcomes. This approach aligns with ethical guidelines that emphasize informed consent, confidentiality, and the therapist's responsibility to use methods that are appropriate for the client and the therapeutic modality. It also supports the RDT's commitment to professional accountability and the advancement of the field by contributing meaningful, ethically gathered data. An incorrect approach that relies solely on pre- and post-intervention standardized questionnaires fails to capture the unique contributions of drama therapy. This method risks oversimplifying complex therapeutic processes and may not reflect the client's lived experience of change. Ethically, it could lead to misrepresentation of therapeutic effectiveness and potentially disadvantage clients whose progress is not well measured by such instruments. It also overlooks the qualitative data that is often central to understanding the impact of drama therapy. Another incorrect approach that involves sharing anonymized client narratives without explicit consent for research purposes, even if intended to illustrate outcomes, constitutes a significant breach of confidentiality. This violates fundamental ethical principles and regulatory requirements regarding client privacy and data protection. The potential for re-identification, however remote, poses a serious risk to the client and the therapist's professional standing. A third incorrect approach that focuses exclusively on therapist self-assessment without client input or external validation neglects the client's perspective as a primary indicator of therapeutic success. While therapist insight is valuable, it is not a complete measure of outcomes. Ethically, this approach can be seen as paternalistic and fails to empower the client in the evaluation process. It also lacks the rigor necessary for demonstrating accountability to clients, stakeholders, or the profession. The professional decision-making process for similar situations should involve a thorough consideration of the ethical principles of beneficence, non-maleficence, autonomy, and justice. Professionals should consult relevant RDT ethical codes and guidelines, as well as any applicable legal frameworks governing client data and research. A multimodal approach to evaluation incorporating both qualitative and quantitative data, should be considered, with a strong emphasis on obtaining informed consent for any data collection or dissemination. Transparency with clients about how their progress will be evaluated and how data will be used is paramount. Question 5. The audit findings indicate a need to better articulate the impact of humanistic approaches employed in drama therapy. Which of the following assessment strategies would best demonstrate the efficacy of these approaches within the RDT's practice? Option A. A declaration that the impact of humanistic drama therapy is inherently subjective and therefore not amenable to any form of assessment or audit. Option B. A singular reliance on standardized, quantitative outcome measures that focus solely on symptom reduction and measurable behavioral targets. Option C. An exclusive focus on the RDT's theoretical knowledge of humanistic psychology without correlating it to specific client progress or outcomes. Option D. A comprehensive evaluation that combines detailed session notes documenting client engagement and self-reported growth, alongside observations of behavioral shifts and client feedback on their therapeutic journey. Correct answer is D. A comprehensive evaluation that combines detailed session notes documenting client engagement and self-reported growth, alongside observations of behavioral shifts and client feedback on their therapeutic journey. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent subjectivity in assessing the impact of humanistic approaches in drama therapy. While the core principles of humanistic psychology emphasize client autonomy, self-actualization, and the therapeutic relationship, quantifying their direct impact on a client's progress can be difficult. Auditors require evidence of efficacy, which can be at odds with the qualitative nature of humanistic interventions. The RDT must demonstrate that their practice, grounded in humanistic principles, is not only ethically sound, but also demonstrably beneficial to the client, even without purely quantitative metrics. This requires a nuanced understanding of how to document and articulate the impact of non-directive, client-centered therapeutic processes. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates qualitative data with observable behavioral changes and client self-report. This aligns with the ethical guidelines for RDTs, which mandate client well-being and professional accountability. Humanistic approaches, by their nature, focus on the client's subjective experience, growth, and empowerment. Therefore, assessing their impact requires methods that capture these elements. This includes detailed session notes that document client engagement, emotional expression, exploration of personal meaning, and instances of increased self-awareness or agency. Client feedback, verbal and nonverbal, and any reported shifts in their daily functioning or relationships serve as crucial indicators of progress. This holistic evaluation respects the client's journey and demonstrates the RDT's commitment to client-centered care, a cornerstone of humanistic practice and ethical RDT practice. Incorrect approaches analysis. One incorrect approach would be to solely rely on standardized quantitative outcome measures that may not adequately capture the nuances of humanistic drama therapy. Such measures often focus on symptom reduction or specific behavioral targets, potentially overlooking the deeper existential and relational growth fostered by humanistic approaches. This fails to acknowledge the qualitative richness of the therapeutic process and may lead to an underestimation of the therapy's impact, potentially violating ethical obligations to accurately represent the client's progress. Another incorrect approach would be to dismiss the need for any form of impact assessment, arguing that humanistic approaches are inherently unmeasurable and therefore beyond the scope of audit. This stance is professionally irresponsible and ethically problematic. It suggests a lack of accountability and an unwillingness to demonstrate the value of drama therapy. Regulatory frameworks, even for humanistic practices, require some level of demonstrable effectiveness and adherence to professional standards, which includes being able to articulate the impact of interventions. A third incorrect approach would be to focus exclusively on the RDT's adherence to theoretical humanistic principles without connecting these to tangible client outcomes. While theoretical grounding is essential, the ultimate goal of therapy is client benefit. An audit would look for evidence that the application of these principles has led to positive change for the client, not just that the RDT understands the theory. Failing to link theoretical practice to client impact can be seen as a failure to meet professional standards of care and efficacy. Professional reasoning. Professionals should adopt a decision-making process that balances theoretical understanding with practical application and client-centered outcomes. When assessing the impact of humanistic approaches, RDTs should 1. Clearly define the client's goals, which may be qualitative and growth-oriented. 2. Select assessment methods that are appropriate for humanistic drama therapy, including qualitative data collection, e.g., reflective journaling, narrative accounts, observation of process, and client self-report. 3. Document how the humanistic principles are being applied in sessions and how they are facilitating client movement towards their goals. 4. Regularly review and reflect on client progress, integrating both subjective and observable indicators. 5. Be prepared to articulate this impact to stakeholders, such as auditors, in a way that respects the nature of humanistic practice, while demonstrating professional competence and ethical accountability. Question 6. Compliance review shows a registered drama therapist, RDT, facilitating a group with members from diverse cultural backgrounds. During a scene exploration, one member expresses discomfort and interprets a symbolic gesture in a way that differs significantly from the dominant cultural understanding within the group. The therapist observes this divergence and its impact on the group dynamic. Which of the following approaches best reflects culturally competent practice for the RDT in this situation? Option A. Facilitate a group discussion to explore the different interpretations of the symbolic gesture, acknowledging the validity of each perspective and collaboratively seeking to understand the cultural influences behind them. Option B. Privately address the member who expressed discomfort after the session, explaining the intended meaning and encouraging them to align with the group's interpretation for therapeutic cohesion. Option C. Gently redirect the conversation back to the original dramatic intent, suggesting that the differing interpretation might be a misunderstanding of the theatrical context. Option D. Pause the session to research the cultural significance of the gesture in the member's background, delaying further exploration until a definitive cultural understanding is established. The correct answer is A. Facilitate a group discussion to explore the different interpretations of the symbolic gesture, acknowledging the validity of each perspective and collaboratively seeking to understand the cultural influences behind them. Explanation. Scenario analysis. This scenario presents a common challenge in drama therapy where a therapist must navigate the complexities of cultural differences within a group setting. The core difficulty lies in balancing the need for universal therapeutic principles with the imperative to respect and integrate diverse cultural expressions and communication styles. Failure to do so can lead to misinterpretations, alienation, and a compromised therapeutic environment, directly impacting the effectiveness and ethical delivery of services. Correct approach analysis. The most effective approach demonstrates a commitment to cultural humility and responsiveness. This involves actively seeking to understand the cultural backgrounds of group members, acknowledging that one's own cultural lens is not universal, and adapting therapeutic interventions to be culturally sensitive and relevant. This aligns with the ethical guidelines for registered drama therapists, RDT, which emphasize the importance of cultural competence, client-centered care, and avoiding harm. By prioritizing open dialogue and collaborative meaning-making, the therapist fosters an inclusive space where all members feel seen, heard, and respected, thereby enhancing therapeutic outcomes. Incorrect approach is analysis. An approach that dismisses or minimizes the cultural expressions of certain group members as mere resistance or misunderstanding fails to acknowledge the validity and significance of cultural differences. This is a direct violation of ethical principles that mandate respect for client diversity and can lead to unintentional harm by invalidating a client's lived experience. It reflects a lack of cultural competence and an ethnocentric perspective. Another incorrect approach involves imposing a singular, culturally dominant interpretation of dramatic material or process onto the group. This disregards the diverse meanings and values that different cultural groups may ascribe to symbols, narratives, and therapeutic actions. Such an approach can alienate group members, create a hostile therapeutic environment, and undermine the core tenets of drama therapy, which is to facilitate self-expression and exploration within a safe and supportive context. This demonstrates a failure to adapt interventions to the specific cultural needs of the group. A third incorrect approach is to avoid addressing cultural differences altogether, hoping they will resolve themselves or remain dormant. This passive stance can inadvertently allow cultural misunderstandings to fester, leading to group fragmentation and a lack of trust. It represents a failure to proactively engage with a critical aspect of the group dynamic, and a dereliction of the therapist's responsibility to create an inclusive and therapeutically effective environment. Professional reasoning. When faced with cultural diversity in a drama therapy group, a professional should first engage in self-reflection regarding their own cultural biases and assumptions. This is followed by actively seeking to understand the cultural backgrounds and communication styles of group members through open-ended questions and attentive listening. The therapist should then collaboratively explore how cultural factors might be influencing the group's process and the interpretation of dramatic material, adapting interventions as needed to ensure inclusivity and respect. This iterative process of inquiry, adaptation, and collaboration is key to effective and ethical practice. Question 7. Assessment of a client's progress in drama therapy who has been exploring themes of social anxiety through improvisational scenes should primarily involve: Option A. The therapist's independent interpretation of the symbolic meaning within the client's dramatic work, focusing on identifying underlying psychological conflicts without direct client input on these interpretations. Option B. A synthesis of the client's self-reported changes in social situations, observed shifts in their dramatic expression of anxiety, and their own interpretations of the therapeutic impact of the improvisations. Option C. A checklist of observable behaviors related to social anxiety, completed solely by the therapist based on their perception of the client's dramatic enactments. Option D. A formal rating of the client's improvisational skills and the aesthetic quality of their dramatic scenes, compared against established benchmarks for theatrical performance. The correct answer is B. A synthesis of the client's self-reported changes in social situations, observed shifts in their dramatic expression of anxiety, and their own interpretations of the therapeutic impact of the improvisations. Explanation. This scenario presents a common challenge in drama therapy, balancing the need for comprehensive client assessment with the ethical imperative of client autonomy and the inherent subjectivity of artistic expression. The registered drama therapist, RDT, must navigate the complexities of interpreting dramatic work as a diagnostic tool while ensuring the assessment process is collaborative and respects the client's lived experience. The challenge lies in moving beyond purely subjective interpretation to a structured, evidence-informed evaluation that informs therapeutic goals without imposing external narratives or prematurely labeling the client. The correct approach represents best professional practice because it aligns with the core ethical principles of drama therapy, emphasizing client-centeredness, informed consent, and the collaborative nature of the therapeutic process. Specifically, it adheres to the RDT's ethical code, which mandates that assessments are conducted with respect for the client's dignity and self-determination. By integrating multiple data points, including client self-report, therapist observation, and the client's own reflections on their dramatic work, the therapist builds a holistic understanding that is grounded in the client's experience. This approach also supports the development of measurable therapeutic goals, allowing for ongoing evaluation of progress in a way that is meaningful to the client. An incorrect approach that relies solely on the therapist's interpretation of the dramatic work without client input fails to acknowledge the client as the expert on their own experience. This can lead to misinterpretations, the imposition of the therapist's own biases, and a violation of client autonomy. Ethically, this breaches the principle of informed consent and can create a power imbalance that is detrimental to the therapeutic relationship. It also lacks the rigor expected of professional assessment, as it is not grounded in observable behaviors or client-acknowledged insights. Another incorrect approach that focuses exclusively on standardized diagnostic criteria, without considering the unique context of drama therapy, risks reducing the client's experience to a set of labels, ignoring the rich qualitative data available through dramatic process. This can lead to a superficial understanding of the client's challenges and strengths, and may not adequately inform the therapeutic interventions. It also overlooks the specific strengths and insights that drama therapy offers, which are often not captured by traditional assessment tools. A third incorrect approach that prioritizes the aesthetic quality of the dramatic work over its therapeutic relevance misinterprets the purpose of drama therapy. While artistic expression is central, the primary goal is therapeutic growth, not artistic critique. Focusing on aesthetic merit can lead to an assessment that is irrelevant to the client's therapeutic needs and can alienate the client if their creative output is judged by external artistic standards. This approach fails to recognize that the value of the dramatic work lies in its capacity to reveal, explore, and transform the client's internal world. The professional decision-making process for similar situations involves a continuous cycle of observation, reflection, and collaboration. The RDT should begin by establishing clear therapeutic goals in partnership with the client. During the drama therapy process, observations should be carefully documented, noting both the dramatic content and the client's engagement. Crucially, regular opportunities for client reflection on their dramatic work and its meaning should be integrated into the sessions. The therapist's interpretation should be offered as hypotheses for exploration, not as definitive diagnoses. The assessment should be an ongoing, dynamic process, with the client's feedback and self-assessment being central to evaluating progress and adjusting therapeutic strategies. This ensures that the assessment remains client-centered, ethically sound, and therapeutically effective. Question 8. Comparative studies suggest that effective drama therapy treatment planning requires a delicate balance between client aspirations and therapeutic efficacy. A client who has recently experienced a significant loss expresses a strong desire to immediately engage in dramatic reenactments of their past to get over it quickly. As a registered drama therapist, RDT, how should you approach goal setting and treatment planning in this situation? Option A. Focus the treatment plan on achieving a generalized outcome of feeling better without delving into specific therapeutic interventions or collaboratively defining measurable goals with the client. Option B. Immediately agree to the client's request for dramatic reenactments, believing that fulfilling their immediate desire is the most direct path to therapeutic progress. Option C. Gently steer the client away from reenactments, explaining that such activities are too emotionally charged for their current state, and propose a plan focused solely on relaxation techniques and mindfulness exercises. Option D. Collaboratively explore the client's desire to reenact, while also discussing the potential emotional impact and introducing alternative or complementary therapeutic goals that address grief processing and coping mechanisms, ensuring the plan is co-created and adaptable. Correct answer is D. Collaboratively explore the client's desire to reenact, while also discussing the potential emotional impact and introducing alternative or complementary therapeutic goals that address grief processing and coping mechanisms, ensuring the plan is co-created and adaptable. Explanation. This scenario presents a common challenge in drama therapy, balancing client autonomy with the therapist's professional judgment and ethical obligations. The client, who has expressed a desire for a specific therapeutic outcome, may not fully grasp the complexities of their condition or the most effective pathways to healing. The drama therapist must navigate this by collaboratively developing goals that are both meaningful to the client and grounded in therapeutic principles, while also adhering to professional standards of practice. The correct approach prioritizes a collaborative, client-centered goal-setting process that is informed by the therapist's expertise. This aligns with the ethical principles of informed consent and client self-determination, as well as the RDT's responsibility to develop treatment plans that are tailored to the individual's needs and are evidence-informed. By engaging the client in a dialogue about their aspirations and gently guiding them towards achievable and therapeutically sound objectives, the therapist fosters a sense of agency and ownership over their healing journey. This approach respects the client's lived experience while ensuring the therapeutic process is structured and effective. An incorrect approach that solely focuses on the client's immediate, potentially unrealistic, desire without professional guidance risks leading to therapeutic stagnation or disappointment. This fails to uphold the therapist's duty of care and professional responsibility to provide competent and ethical treatment. Another incorrect approach that dismisses the client's expressed desires entirely, imposing a rigid plan without genuine collaboration, undermines the therapeutic alliance and violates principles of client autonomy and respect. Such an approach could be seen as paternalistic and may alienate the client, hindering progress. Third incorrect approach that prioritizes external validation or a generic outcome over the client's unique needs and context neglects the individualized nature of drama therapy and the importance of tailoring interventions to the specific client. Professionals should employ a decision-making process that begins with active listening and empathic understanding of the client's perspective. This is followed by an assessment of the client's strengths, challenges, and stated goals. The therapist then uses their professional knowledge and experience to propose potential therapeutic avenues, explaining the rationale behind them and exploring how they might align with or modify the client's initial desires. The process is iterative, involving ongoing dialogue and adjustment of goals and plans as the therapeutic relationship develops and the client progresses. This ensures that the treatment plan is a dynamic, shared document that respects both the client's voice and the therapist's professional expertise. Question 9. The efficiency study reveals that registered drama therapists, RDT, often face challenges in accurately identifying and documenting continuing education and professional development, CEPT, activities that meet credentialing requirements. Considering the RDT's ethical obligation to maintain and enhance professional competence, which of the following approaches to CEPT best aligns with regulatory expectations and professional best practices for credential renewal? Option A. Counting attendance at general arts festivals and personal creative endeavors, such as learning a new musical instrument for leisure, as qualifying CEPT, assuming any engagement with the arts contributes to therapeutic insight. Option B. Engaging in a diverse range of artistic workshops and personal enrichment seminars, prioritizing those that are easily accessible and offer a high number of credit hours, regardless of their direct applicability to drama therapy practice. Option C. Relying on informal learning experiences, such as observing other therapists in unrelated fields or attending broad-spectrum wellness retreats, without formal documentation or verification of content relevance to drama therapy. Option D. Actively seeking out and participating in training, supervision, and scholarly activities that directly enhance skills, knowledge, and ethical understanding pertinent to the practice of drama therapy, ensuring each activity is documented with clear relevance to the RDT scope of practice. The correct answer is B. Engaging in a diverse range of artistic workshops and personal enrichment seminars, prioritizing those that are easily accessible and offer a high number of credit hours, regardless of their direct applicability to drama therapy practice. Explanation. Scenario analysis. This scenario presents a professional challenge for a registered drama therapist, RDT, regarding the maintenance of their credential through continuing education and professional development, CEPT. The challenge lies in discerning which activities genuinely contribute to professional growth and meet the specific requirements set forth by the credentialing body, ensuring the therapist remains competent and ethically grounded. The RDT must navigate a landscape of potential learning opportunities, some of which may be tangential or not directly applicable to the core competencies of drama therapy. Correct approach analysis. The correct approach involves actively seeking out and engaging in CEPT activities that are directly relevant to the practice of drama therapy, as defined by the RDT credentialing standards. This includes workshops, courses, supervision, or research that enhances skills in therapeutic techniques, ethical practice, client assessment, or understanding of specific populations relevant to drama therapy. This aligns with the ethical obligation of RDTs to maintain and improve their professional competence, as mandated by professional standards and likely outlined in the RDT's governing body's ethical code. Such engagement ensures that the therapist's practice remains informed by current knowledge and best practices, directly benefiting clients and upholding the integrity of the profession. Incorrect approach is analysis. One incorrect approach involves prioritizing CEPT activities based solely on convenience or perceived ease of completion, without regard for their direct relevance to drama therapy practice. This fails to meet the spirit and likely the letter of CEPT requirements, which are designed to ensure ongoing professional development in the specific field. This could lead to a superficial fulfillment of requirements, leaving the therapist with outdated or irrelevant knowledge, which is an ethical failing as it compromises client care. Another incorrect approach is to count activities that are primarily for personal enjoyment or unrelated professional development, e.g., a general business management course not tailored to therapeutic practice, or a hobby-related workshop, towards RDT CEPT requirements. While personal growth is valuable, it does not fulfill the mandate for professional development specific to drama therapy. This misrepresents the therapist's qualifications and potentially violates the credentialing body's rules, which are in place to safeguard the public. A third incorrect approach is to assume that any activity involving the arts automatically qualifies as CEPT for an RDT. While the arts are foundational to drama therapy, the CEPT must specifically focus on the therapeutic application of these arts, the theoretical underpinnings of drama therapy, or the ethical considerations within the therapeutic context. A purely artistic performance or a workshop on a different art form without a therapeutic or pedagogical component would not suffice. This demonstrates a misunderstanding of the specific professional requirements of the RDT credential. Professional reasoning. Professionals should approach CEPT planning with a proactive and discerning mindset. This involves regularly reviewing the RDT credentialing body's guidelines for CEPT, identifying personal and professional growth areas relevant to their practice, and then strategically selecting activities that directly address these areas. Maintaining a log of completed CEPT activities with clear documentation of their relevance is crucial for compliance and for demonstrating a commitment to ongoing professional excellence. When in doubt about the eligibility of an activity, consulting the credentialing body's guidelines or contacting them directly is the most responsible course of action. Question 10. To address the challenge of demonstrating the impact of drama therapy interventions, an RDT is considering various approaches to incorporating standardized measures into their practice. Which of the following approaches best aligns with the ethical and professional standards for registered drama therapists in assessing client progress? Option A. Selecting standardized measures that have established psychometric validity and reliability for mental health outcomes and are appropriate for the client population and therapeutic goals, integrating the data to inform treatment planning and communicate progress. Option B. Prioritizing the use of easily quantifiable standardized measures that may not fully capture the qualitative changes inherent in dramatic expression, even if they are less relevant to the core therapeutic process. Option C. Relying solely on subjective client self-reports and therapist observations without employing any systematic or standardized assessment tools. Option D. Utilizing a widely recognized standardized measure without verifying its psychometric properties or its suitability for the specific client population and the unique aspects of drama therapy. The correct answer is A. Selecting standardized measures that have established psychometric validity and reliability for mental health outcomes and are appropriate for the client population and therapeutic goals, integrating the data to inform treatment planning and communicate progress. Explanation. The scenario presents a common challenge for registered drama therapists, RDT, in demonstrating the efficacy of their interventions. The professional challenge lies in balancing the qualitative, often experiential nature of drama therapy with the increasing demand for evidence-based practice and accountability. RDTs must select and implement assessment tools that are both sensitive to the nuances of dramatic expression and capable of yielding data that can inform treatment, communicate progress to stakeholders, and contribute to the broader understanding of drama therapy's impact. This requires careful judgment in choosing measures that align with therapeutic goals and client populations, while also adhering to ethical guidelines regarding client welfare and professional competence. The correct approach represents best professional practice because it prioritizes the selection of standardized measures that have demonstrated psychometric validity and reliability within the context of mental health and therapeutic outcomes. This ensures that the data collected is meaningful and can be interpreted with a degree of confidence. Furthermore, it emphasizes the importance of aligning the chosen measures with the specific goals of the drama therapy intervention and the characteristics of the client population. This thoughtful integration of assessment into the therapeutic process allows for objective tracking of progress, informs clinical decision-making, and provides a basis for communicating the value of drama therapy to clients, referral sources, and funding bodies, thereby upholding professional standards of accountability and evidence-based practice as expected within the RDT framework. An incorrect approach that relies solely on anecdotal observation without any systematic data collection fails to meet the professional standard of accountability. This approach lacks objectivity and makes it difficult to demonstrate progress or identify areas for improvement, potentially leading to a lack of transparency and hindering the ability to justify therapeutic services. It also risks overlooking subtle but significant changes in a client's presentation that a standardized measure might capture. Another incorrect approach that involves using a standardized measure without understanding its psychometric properties or its appropriateness for the specific client population is ethically problematic. This can lead to misinterpretation of results, potentially inaccurate assessments of client progress, and can even be detrimental to the client if interventions are adjusted based on flawed data. It violates the RDT's responsibility to practice competently and ethically, ensuring that assessment tools are used appropriately and with due consideration for their limitations and the population being assessed. A third incorrect approach that focuses exclusively on measures that are easily quantifiable, even if they do not capture the core elements of drama therapy, also represents a failure in professional decision-making. While quantitative data is valuable, an overemphasis on easily measurable outcomes at the expense of capturing the qualitative richness of dramatic expression can lead to an incomplete or distorted picture of therapeutic change. This approach may not adequately reflect the unique contributions of drama therapy and could lead to a devaluing of its specific modalities. The professional decision-making process for similar situations should involve a systematic evaluation of potential assessment tools. This includes researching the psychometric properties of available measures, considering their alignment with the theoretical underpinnings of drama therapy and the specific therapeutic goals, and assessing their suitability for the client population in terms of cultural relevance, developmental stage, and cognitive abilities. RDTs should also consider how the chosen measures will be integrated into the therapeutic process and how the data will be used to inform ongoing treatment and communicate outcomes. Ethical considerations, such as informed consent regarding assessment procedures and the protection of client confidentiality, must be paramount throughout this process. Question 11. Stakeholder feedback indicates a need for clearer evidence of the impact of the drama therapy program on participants' social engagement and emotional regulation. As a registered drama therapist, RDT, which approach to assessing program outcomes would best address these concerns while adhering to professional ethical standards. Option A. Focusing exclusively on detailed narrative descriptions of individual client journeys, highlighting moments of breakthrough without systematically collecting data on frequency or measurable changes. Option B. Employing a mixed methods approach that combines structured pre- and post-program surveys measuring social interaction frequency and self-reported emotional regulation skills with qualitative data from client journals and therapist observations of behavioral shifts during sessions. Option C. Implementing a quantitative assessment that exclusively uses standardized psychological scales to measure anxiety and depression levels, assuming these are direct proxies for social engagement and emotional regulation. Option D. Relying solely on client testimonials and anecdotal reports gathered informally after sessions to illustrate positive changes in social engagement and emotional regulation. The correct answer is B. Employing a mixed methods approach that combines structured pre- and post-program surveys measuring social interaction frequency and self-reported emotional regulation skills with qualitative data from client journals and therapist observations of behavioral shifts during sessions. Explanation. This scenario presents a professional challenge because it requires a registered drama therapist, RDT, to balance the subjective richness of qualitative data with the need for objective, measurable outcomes to demonstrate program effectiveness to diverse stakeholders. The RDT must navigate the inherent complexities of assessing therapeutic impact, which often involves nuanced emotional and behavioral shifts that are not easily quantifiable. Careful judgment is required to select assessment methods that are both ethically sound and practically effective in capturing the full spectrum of client progress. The correct approach represents best professional practice because it integrates both qualitative and quantitative methods to provide a comprehensive understanding of program impact. This aligns with ethical guidelines for RDTs which emphasize thorough and accurate assessment. By using qualitative methods like client narratives and observational notes, the RDT can capture the depth and personal meaning of therapeutic experiences, which are crucial for understanding the how and why of change. Simultaneously, incorporating quantitative measures, such as pre- and post-program surveys on specific symptom reduction or behavioral frequency, provides objective data that can demonstrate measurable progress and support program justification to funders and administrators. This dual approach offers a more robust and credible evaluation of the RDT's work. An incorrect approach that relies solely on qualitative data, while rich in narrative, may fail to provide the objective evidence stakeholders require to understand program efficacy and allocate resources. This could be seen as a failure to meet professional standards of accountability and evidence-based practice, potentially hindering future program support. An incorrect approach that relies exclusively on quantitative data risks oversimplifying the complex therapeutic process and may miss crucial, subtle changes in a client's well-being that are not easily captured by numerical scales. This can lead to a superficial understanding of impact and may not accurately reflect the true value of the drama therapy intervention, potentially misrepresenting the client's experience and the therapist's effectiveness. An incorrect approach that focuses on anecdotal evidence without systematic collection or analysis, even if positive, lacks the rigor required for professional assessment. This can lead to biased interpretations and an inability to generalize findings or demonstrate consistent program outcomes, undermining professional credibility. The professional decision-making process for similar situations involves first identifying the specific goals of the assessment and the information needs of the stakeholders. Then, the RDT should consider the nature of the therapeutic intervention and the expected outcomes, determining which assessment methods are best suited to capture these changes. A critical step is to ensure that the chosen methods are ethically appropriate, respecting client confidentiality and autonomy, and that they provide a balanced perspective, integrating both subjective experience and objective measurement where feasible. This systematic approach ensures that the assessment is both meaningful and defensible. Question 12. Cost-benefit analysis shows that providing clients with specific, detailed interpretive feedback on their dramatic enactments can be highly beneficial for insight and growth, but also carries risks if not delivered appropriately. A registered drama therapist, RDT, is working with a client who has explicitly requested detailed feedback on their character's motivations and emotional arc within a recent dramatic exercise. The RDT has concerns that the client may not be emotionally prepared to process such direct interpretation at this stage of therapy. Considering the RDT's ethical obligations and the principles of effective drama therapy, which of the following represents the most therapeutically sound and ethically responsible approach? Option A. Engage in a dialogue with the client to explore their reasons for wanting this specific type of feedback and to collaboratively determine the most beneficial way to provide it, considering the client's current therapeutic readiness and the overall goals of the session. Option B. Refuse to provide detailed interpretive feedback, explaining that it is not standard practice for the RDT to offer such specific analysis. Option C. Immediately provide the detailed interpretive feedback as requested by the client, trusting their judgment on what they can handle. Option D. Offer very general observations about the client's performance without addressing the specific request for interpretive feedback on character motivations. The correct answer is A. Engage in a dialogue with the client to explore their reasons for wanting this specific type of feedback and to collaboratively determine the most beneficial way to provide it, considering the client's current therapeutic readiness and the overall goals of the session. Explanation. Scenario analysis. This scenario presents a common challenge in therapeutic practice where a registered drama therapist, RDT, must balance the client's expressed desire for a specific type of feedback with the therapist's professional judgment regarding its efficacy and ethical implications. The RDT must consider the potential benefits of client-centered feedback against the risks of providing information that might be misinterpreted, overwhelming, or detrimental to the therapeutic process. The challenge lies in navigating the client's agency while upholding professional standards of care and ensuring the feedback serves the client's therapeutic goals. Correct approach analysis. The correct approach prioritizes a collaborative and ethically grounded feedback process. It involves the RDT actively listening to the client's preferences for feedback, exploring the rationale behind these preferences, and then transparently explaining their own professional considerations. This approach aligns with the RDT's ethical obligation to informed consent and client autonomy, while also ensuring that feedback is delivered in a manner that is therapeutic, developmentally appropriate, and aligned with the established goals of drama therapy. The RDT's role is to guide the process, not simply to comply with a client's request if it compromises therapeutic integrity. This involves assessing the client's readiness for certain types of feedback and ensuring that the feedback is delivered in a way that promotes insight and growth, rather than causing distress or confusion. This aligns with the core principles of drama therapy, which emphasize the use of creative processes to facilitate self-discovery and healing. Incorrect approaches analysis. One incorrect approach involves immediately providing the detailed, interpretive feedback the client requests without further exploration. This fails to uphold the RDT's responsibility to assess the client's readiness and capacity to process such feedback. It risks overwhelming the client, potentially leading to misinterpretation, increased anxiety, or a premature termination of therapy if the feedback is perceived negatively. Ethically, this bypasses the crucial step of ensuring the feedback is genuinely beneficial and delivered in a therapeutic context, potentially violating the principle of do no harm. Another incorrect approach is to dismiss the client's request for feedback outright, stating that it is not part of the RDT's standard practice. This approach disregards the client's expressed needs and preferences, potentially alienating them and damaging the therapeutic alliance. It fails to acknowledge the client's agency in the therapeutic process and may be perceived as unsupportive or dismissive, hindering the collaborative nature of drama therapy. Ethically, this can be seen as a failure to engage with the client's therapeutic goals and a lack of responsiveness to their expressed needs. A third incorrect approach is to provide vague or overly generalized feedback that does not address the client's specific request. While seemingly safe, this can leave the client feeling unheard and unsatisfied, undermining the therapeutic relationship. It fails to leverage the RDT's expertise in providing targeted and meaningful feedback that can facilitate deeper insight. Ethically, this represents a missed opportunity to provide effective therapeutic intervention and can lead to client frustration and a lack of progress. Professional reasoning. Professionals should approach feedback by first establishing a clear understanding of the client's request and their underlying motivations. This involves active listening and open-ended questioning. Following this, the RDT should consider the therapeutic goals, the client's current emotional state, and their capacity to integrate the feedback. The RDT must then communicate their professional judgment transparently, explaining the rationale behind their approach to feedback delivery. This process ensures that feedback is a collaborative endeavor, grounded in ethical practice, and tailored to the individual needs of the client, thereby maximizing its therapeutic benefit. Question 13. Benchmark analysis indicates that a registered drama therapist, RDT, is working with a client using narrative therapy principles within a drama therapy framework to address feelings of powerlessness. The RDT is seeking to assess the impact of the intervention. Which of the following approaches best reflects a comprehensive and ethically sound assessment of therapeutic impact in this context? Option A. Measuring the client's reduction in reported instances of feeling powerless using a standardized psychological questionnaire, without further qualitative exploration of their narrative shifts. Option B. Assessing the client's adherence to dramatic exercises and their ability to follow the RDT's directives during sessions as indicators of therapeutic progress. Option C. Focusing solely on the RDT's interpretation of the client's dramatic enactments and narrative constructions, without seeking direct client feedback on their perceived changes. Option D. Evaluating the client's ability to articulate new, empowering narratives about their past and present experiences, alongside observable increases in their willingness to engage in dramatic exploration and express a wider range of emotions. Correct answer is D. Evaluating the client's ability to articulate new, empowering narratives about their past and present experiences, alongside observable increases in their willingness to engage in dramatic exploration and express a wider range of emotions. Explanation. This scenario presents a professional challenge due to the inherent subjectivity in assessing the impact of narrative therapy within a drama therapy context, particularly when aiming for measurable outcomes. The RDT must balance the qualitative richness of narrative exploration with the need for demonstrable client progress, all while adhering to ethical guidelines that prioritize client well-being and professional competence. Careful judgment is required to select an assessment method that is both therapeutically sound and ethically defensible. The correct approach represents best professional practice because it aligns with the RDT's ethical obligation to engage in evidence-informed practice and to accurately document client progress. By focusing on the client's self-reported narrative shifts and the RDT's observational data regarding engagement and expression, this method respects the client's subjective experience while providing qualitative evidence of therapeutic impact. This approach is consistent with the RDT's scope of practice, which emphasizes the use of dramatic processes to facilitate therapeutic change and avoids making unsubstantiated claims about the efficacy of the intervention. It prioritizes the client's voice and experience, a cornerstone of ethical therapeutic practice. An incorrect approach that relies solely on predefined, quantitative outcome measures without considering the client's narrative context would be ethically problematic. This fails to acknowledge the unique and often non-linear nature of therapeutic change facilitated by narrative therapy and drama. It could lead to misinterpreting or dismissing the client's lived experience of progress, potentially causing harm by invalidating their journey. Furthermore, it may violate professional standards by oversimplifying complex therapeutic processes and presenting potentially misleading data. Another incorrect approach that focuses exclusively on the RDT's interpretation of the client's narrative, without incorporating the client's own articulation of change or observable behavioral shifts, would also be professionally unacceptable. This risks imposing the therapist's agenda or biases onto the client's experience, undermining the collaborative nature of narrative therapy, and potentially leading to misdiagnosis or inappropriate treatment adjustments. It also fails to provide a balanced and client-centered assessment of impact. The professional decision-making process for similar situations should involve a thorough understanding of the client's goals and the therapeutic modality being employed. The RDT should consider how narrative therapy and drama can be integrated to facilitate client-identified change. Assessment should be a continuous, collaborative process, incorporating client self-report, observable behaviors, and the RDT's professional observations. The chosen assessment methods should be appropriate to the therapeutic goals and the client's capacity, and should be documented transparently, reflecting the qualitative and subjective nature of therapeutic progress where applicable. Ethical considerations, including informed consent regarding assessment methods and the protection of client confidentiality, must guide all decisions. Question 14. Consider a scenario where a registered drama therapist, RDT, is working with a client who presents with a history of trauma, significant self-criticism, and difficulty forming stable relationships. The RDT is contemplating which theoretical model to primarily utilize. Which of the following approaches would best align with the RDT's ethical obligations and the multifaceted nature of the client's presentation? Option A. Adopting a purely improvisational, unstructured approach, allowing the client to freely explore their emotions and experiences without a predefined theoretical framework. Option B. Integrating psychodynamic principles to explore unconscious conflicts and defense mechanisms with narrative therapy to help the client reframe their life story and construct a more empowering self-narrative. Option C. Primarily employing behavioral modification techniques to address specific maladaptive behaviors, focusing on reinforcement and extinction of undesirable actions. Option D. Strictly adhering to a single, highly specialized theoretical model, such as existential drama therapy, without considering the potential benefits of other theoretical perspectives for this particular client. The correct answer is B. Integrating psychodynamic principles to explore unconscious conflicts and defense mechanisms with narrative therapy to help the client reframe their life story and construct a more empowering self-narrative. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of applying theoretical models in drama therapy, especially when a client's presentation is multifaceted and potentially influenced by various factors. The RDT must exercise careful judgment to select an approach that is not only theoretically sound, but also ethically aligned with client well-being and professional standards. The challenge lies in discerning the most appropriate theoretical lens without oversimplifying the client's experience or imposing a framework that doesn't resonate. Correct approach analysis. The correct approach, focusing on integrating psychodynamic principles with narrative therapy, represents best professional practice because it acknowledges the depth of unconscious processes, psychodynamic, while empowering the client to reframe their life story and find meaning, narrative. This integration is ethically justified, as it respects client autonomy by allowing them to construct their own narrative while providing a structured framework for exploring underlying conflicts and patterns. The RDT's ability to draw from multiple, complementary theoretical models demonstrates a sophisticated understanding of drama therapy's adaptability and its capacity to address complex human experiences. This aligns with the RDT's ethical obligation to provide competent and individualized care, utilizing a breadth of knowledge to best serve the client. Incorrect approaches analysis. An approach solely focused on behavioral modification techniques without addressing the underlying emotional and narrative components would be ethically flawed. It risks pathologizing the client's behavior without exploring its roots, potentially leading to superficial symptom management rather than genuine healing. This fails to meet the RDT's responsibility to explore the client's internal world and the meaning they ascribe to their experiences. An approach that exclusively utilizes a purely improvisational, unstructured method without any theoretical grounding could be problematic. While improvisation is a core drama therapy tool, a complete lack of theoretical framework might lead to a chaotic therapeutic process, potentially overwhelming the client or failing to provide the necessary structure for exploration and integration. This could be seen as a failure to provide a competent and well-considered therapeutic intervention, potentially not meeting the client's needs for a safe and purposeful exploration. An approach that rigidly applies a single, highly specialized theoretical model without considering the client's unique presentation or the potential benefits of other perspectives would be a failure of individualized care. This demonstrates a lack of flexibility and an inability to adapt the therapeutic approach to the client's specific needs, which is a core ethical principle in therapeutic practice. It prioritizes the model over the client's lived experience. Professional reasoning. Professionals should engage in a continuous process of assessment and reflection. This involves understanding the client's presenting issues, their history, and their stated goals. They should then consider various theoretical models within drama therapy, evaluating their potential applicability and ethical implications for the specific client. The decision-making process should prioritize client-centered care, ensuring that the chosen approach is both theoretically robust and ethically sound, allowing for flexibility and integration as the therapeutic relationship evolves. This involves a deep understanding of the RDT's scope of practice and ethical guidelines, ensuring that interventions are evidence-informed and client-responsive. Question 15. The investigation demonstrates that a registered drama therapist, RDT, is working with a client who exhibits significant resistance and difficulty forming a trusting relationship due to past traumatic experiences. Which of the following approaches best supports the development of a strong therapeutic alliance in this context? Option A. The therapist relies on established dramatic techniques without significant adaptation, expecting the client to conform to the therapeutic structure. Option B. The therapist focuses on interpreting the client's resistance as a direct manifestation of their trauma, pushing for deeper emotional exploration without explicit client consent. Option C. The therapist prioritizes establishing a safe and predictable environment, proceeding at the client's pace, and collaboratively exploring the client's comfort level with different dramatic exercises, while regularly seeking supervision to process the therapeutic relationship. Option D. The therapist immediately introduces challenging dramatic improvisations to break through the client's defenses and accelerate the therapeutic process. The correct answer is C. The therapist prioritizes establishing a safe and predictable environment, proceeding at the client's pace, and collaboratively exploring the client's comfort level with different dramatic exercises, while regularly seeking supervision to process the therapeutic relationship. Explanation. The investigation demonstrates a scenario where a registered drama therapist, RDT, is navigating the complexities of establishing and maintaining a strong therapeutic alliance, with a client presenting with significant trust issues stemming from past relational trauma. This situation is professionally challenging because the RDT must balance the inherent vulnerability of the therapeutic process with the client's deeply ingrained defenses, requiring a nuanced understanding of how to foster safety and connection without overwhelming the client. Careful judgment is required to adapt therapeutic interventions to the client's pace and readiness, ensuring that the alliance remains the bedrock of the work. The correct approach represents best professional practice because it prioritizes the client's autonomy and pace in building trust, recognizing that a strong therapeutic alliance is foundational to effective drama therapy. This approach aligns with the ethical principles of beneficence and non-maleficence, ensuring that the therapist acts in the client's best interest and avoids causing harm. Specifically, it reflects the RDT's responsibility to create a safe and predictable environment, a core tenet of drama therapy practice, which allows the client to gradually engage with therapeutic material. This is supported by the RDT's commitment to ongoing self-reflection and supervision, ensuring that their interventions are client-centered and ethically sound, consistent with professional standards for RDTs. An incorrect approach that focuses solely on rapid progress and pushing the client to engage in more intense dramatic exercises without adequate attunement to their readiness would represent a regulatory and ethical failure. This would violate the principle of respecting client autonomy and could lead to re-traumatization, directly contravening the RDT's duty to do no harm. Another incorrect approach that involves the therapist imposing their own agenda or interpretations without sufficient collaborative exploration with the client would also be ethically problematic. This undermines the collaborative nature of the therapeutic alliance, a cornerstone of drama therapy, and could be seen as a failure to maintain professional boundaries and respect the client's lived experience. A third incorrect approach that neglects to seek supervision or consultation when encountering significant challenges in building the alliance would be a failure to adhere to professional development standards and could lead to compromised client care. The professional decision-making process for similar situations involves a continuous cycle of assessment, intervention, and reflection. Professionals should begin by thoroughly assessing the client's presentation, including their history, current challenges, and readiness for engagement. Interventions should be carefully chosen and adapted to the client's needs, with a constant focus on building and maintaining the therapeutic alliance. Crucially, professionals must engage in regular self-reflection to monitor their own biases and reactions, and seek supervision or consultation when facing complex ethical or clinical dilemmas. This iterative process ensures that the therapist remains attuned to the client's experience and can adapt their practice to foster a safe and effective therapeutic relationship. Question 16. Upon reviewing a drama therapy group session where one member's intense emotional expression, while authentic to their process, significantly disrupted the flow and comfort of other participants, what is the most therapeutically sound and ethically responsible approach for the registered drama therapist, RDT, to take in the immediate aftermath of the incident? Option A. Acknowledge the individual's authentic expression, then facilitate a group discussion about how different emotional expressions impact the ensemble and explore shared responsibility for maintaining a safe and productive group space. Option B. Privately speak with the individual after the session to explain the impact of their behavior on the group and assign them a task to reflect on their emotional regulation. Option C. Intervene by redirecting the entire group into a calming activity without acknowledging the specific incident or the individual's experience. Option D. Immediately address the individual directly, explaining how their behavior was disruptive and suggesting they take a break from the session to regain composure. The correct answer is A. Acknowledge the individual's authentic expression, then facilitate a group discussion about how different emotional expressions impact the ensemble and explore shared responsibility for maintaining a safe and productive group space. Explanation. This scenario presents a common challenge in group drama therapy where individual client needs can conflict with the needs of the ensemble. The RDT must balance fostering individual growth with maintaining group cohesion and safety. The professional challenge lies in navigating these competing demands without alienating individuals or jeopardizing the group's therapeutic progress. Careful judgment is required to ensure that interventions support both individual expression and collective participation. The correct approach represents best professional practice because it prioritizes a balanced, client-centered, and ethically grounded response by first acknowledging the individual's experience and then facilitating a group discussion about the impact of their actions on the ensemble. The RDT is adhering to principles of respect, autonomy, and therapeutic process. This method allows for a shared understanding of group norms and the consequences of individual behavior within the collective, fostering accountability and mutual support, which are core tenets of effective group drama therapy. This aligns with the RDT's ethical obligation to promote the well-being of all group members and to manage group dynamics constructively. An incorrect approach that focuses solely on the individual's perceived disruption without exploring the group's reaction fails to acknowledge the interconnectedness of ensemble work. This can lead to the individual feeling singled out and misunderstood, potentially hindering their engagement and the group's ability to process the situation collaboratively. Ethically, this approach neglects the broader impact on the group's therapeutic environment. Another incorrect approach that immediately imposes a consequence without exploration or group dialogue bypasses the crucial therapeutic opportunity to understand the underlying dynamics. This can be perceived as punitive rather than therapeutic, potentially damaging trust within the group and between the therapist and clients. It fails to uphold the principle of informed consent and collaborative problem-solving, inherent in ethical practice. A third incorrect approach that dismisses the individual's contribution as simply difficult behavior, without further investigation, risks pathologizing the client and overlooks potential underlying reasons for their actions. This can lead to a superficial understanding of the group dynamic and may not address the root cause of the tension, thereby failing to promote genuine therapeutic growth for the individual or the group. The professional decision-making process for similar situations involves a multi-step approach. 1. Observe and assess the immediate situation, noting both individual behavior and group response. 2. Validate the individual's experience while also acknowledging the impact on the group. 3. Facilitate a group process that allows for open communication about the situation, exploring different perspectives and feelings. 4. Collaboratively problem solve, guiding the group towards understanding and agreed-upon ways of moving forward. 5. Document the process and outcomes, reflecting on the effectiveness of the intervention. This framework ensures that interventions are therapeutic, ethical, and responsive to the complex interplay of individual and group needs. Question 17. The performance metrics show a consistent pattern of a client presenting with increased physical restlessness and agitated gestures during sessions, particularly when exploring emotionally charged themes. The registered drama therapist, RDT, has observed this for several weeks. What is the most therapeutically sound and ethically responsible course of action? Option A. Immediately suggest a referral to a psychiatrist for medication evaluation due to the observed physical restlessness. Option B. Gently redirect the client's attention away from the emotionally charged themes and towards more neutral topics to reduce the physical agitation. Option C. Advise the client to consciously suppress their physical movements to maintain a calmer session environment. Option D. Integrate the client's physical restlessness into the drama therapy process by exploring the embodied sensations and meanings associated with these movements, while continuing to monitor for any signs of escalating distress or need for alternative strategies. The correct answer is D. Integrate the client's physical restlessness into the drama therapy process by exploring the embodied sensations and meanings associated with these movements, while continuing to monitor for any signs of escalating distress or need for alternative strategies. Explanation. This scenario presents a professional challenge because it requires the registered drama therapist, RDT, to interpret subtle, nonverbal cues within a therapeutic context, balancing client expression with professional responsibility. The RDT must consider how movement and body language, while powerful therapeutic tools, can also be indicators of distress or unmet needs that require careful, ethical, and effective intervention. The challenge lies in discerning the therapeutic utility of the client's physical expression from potential signs of escalating dysregulation or a need for a different therapeutic modality. Correct approach represents best professional practice because it prioritizes client safety and therapeutic efficacy through a multifaceted, client-centered response. It acknowledges the client's embodied experience as valid and significant, while also demonstrating a commitment to ongoing assessment and adaptation of the therapeutic plan. This approach aligns with the ethical guidelines for RDTs, which emphasize the importance of understanding the client holistically, including their nonverbal communication, and responding in a way that is both sensitive and clinically informed. It also reflects a commitment to professional development and consultation, ensuring the therapist is equipped to handle complex presentations. An incorrect approach that focuses solely on suppressing or ignoring the client's physical expression would be a significant ethical failure. It disregards the client's embodied experience, potentially invalidating their feelings and hindering therapeutic progress. This could violate principles of client autonomy and the therapeutic alliance. Another incorrect approach that immediately escalates to a more restrictive intervention without adequate assessment or client engagement would also be problematic. It might be seen as a premature judgment, failing to explore the therapeutic potential of the client's current expression, and potentially causing unnecessary distress or alienation. A third incorrect approach that relies on generalized assumptions about body language without considering the individual client's context and history will be a failure of individualized care and could lead to misinterpretation and inappropriate interventions, violating the RDT's duty of care. The professional decision-making process for similar situations should involve a continuous cycle of observation, interpretation, intervention, and reevaluation. The RDT should first observe the client's movement and body language with curiosity and without immediate judgment. Then, they should attempt to understand the potential meaning of these expressions within the client's narrative and therapeutic goals, considering the client's history and cultural background. Interventions should be tailored to the client's needs, potentially involving mirroring, embodying, or exploring the sensations associated with the movement. Crucially, the RDT must remain attuned to the client's response to interventions and be prepared to adjust their approach, seeking supervision or consultation when necessary, to ensure the highest standard of care. Question 18. Examination of the data shows a registered drama therapist, RDT, is considering incorporating a specific genre of music known for its intense emotional evocation into a session with a client who has a history of trauma. The RDT has not yet discussed this specific musical choice with the client, or conducted a detailed assessment of the client's current emotional state or potential auditory sensitivities. Which of the following approaches best reflects the RDT's professional responsibilities regarding the use of music and sound in this context? Option A. Immediately incorporate the music, as music is a universally recognized therapeutic tool that can benefit all clients. Option B. Avoid using any music or sound in this session, as the client's history of trauma makes any auditory stimulus potentially harmful. Option C. Proceed with the musical intervention as planned, believing that the intensity of the music will facilitate a breakthrough in the client's processing of trauma. Option D. Delay the use of this specific music, conduct a thorough assessment of the client's history and current state, discuss the proposed intervention and its potential impact with the client, and obtain informed consent before proceeding. The correct answer is C. Proceed with the musical intervention as planned, believing that the intensity of the music will facilitate a breakthrough in the client's processing of trauma. Explanation. This scenario presents a professional challenge because the registered drama therapist, RDT, must balance the creative potential of music and sound with the ethical imperative to ensure client safety, efficacy, and informed consent within the specific regulatory framework governing RDT practice. The use of music and sound, while powerful tools, can evoke strong emotional responses and may have unintended consequences if not carefully considered and implemented. The RDT must assess the appropriateness of these interventions based on the client's individual needs, therapeutic goals, and potential sensitivities, all while adhering to the RDT's code of ethics and any relevant professional guidelines. The correct approach represents best professional practice because it prioritizes a client-centered, evidence-informed, and ethically sound methodology. This involves a thorough assessment of the client's history, current presentation, and potential responses to music and sound. It emphasizes obtaining informed consent, which is a cornerstone of ethical practice, ensuring the client understands the nature of the intervention, its potential benefits and risks, and has the autonomy to agree or decline. Furthermore, it mandates ongoing monitoring and adaptation of the intervention based on the client's feedback and progress, demonstrating a commitment to therapeutic efficacy and client well-being. This aligns with the RDT's responsibility to practice within their scope and to utilize interventions that are both appropriate and beneficial. Each incorrect approach represents specific regulatory or ethical failures. One incorrect approach might involve the indiscriminate use of music and sound without prior assessment or consent. This fails to uphold the principle of informed consent, potentially exposing the client to distressing experiences without their agreement or understanding. It also neglects the RDT's duty to assess the suitability of interventions, which could lead to therapeutic harm or ineffectiveness. Another incorrect approach might be to avoid music and sound entirely due to a lack of personal comfort or training, even when it could be a highly beneficial tool for the client. This represents a failure to utilize potentially effective therapeutic modalities and could limit the client's access to comprehensive care, potentially violating the RDT's commitment to providing the most appropriate and beneficial services. A third incorrect approach could involve using music and sound in a way that is not aligned with the therapeutic goals, perhaps for the therapist's own enjoyment, or to fill silence without therapeutic purpose. This deviates from the core principle of client-centered therapy and could be seen as a misuse of therapeutic tools, potentially leading to a lack of progress or even client disengagement. The professional decision-making process for similar situations should involve a systematic approach. 1. Client assessment. Thoroughly understand the client's history, presenting issues, strengths, and potential vulnerabilities, including any known sensitivities to auditory stimuli. 2. Therapeutic goal alignment. Determine how the use of music and sound directly supports the established therapeutic goals for the client. 3. Intervention selection. Choose specific music or sound elements that are appropriate for the client's needs and the therapeutic context. 4. Informed consent. Clearly explain the proposed use of music and sound, including potential effects, benefits, risks, and alternatives, and obtain explicit consent. 5. Implementation and monitoring. Introduce the intervention thoughtfully and continuously observe the client's responses, adjusting as needed. 6. Documentation. Record the rationale for using music and sound, the client's response, and any modifications made. 7. Ethical review. Regularly consult the RDT's Code of Ethics and Professional Guidelines to ensure all actions are compliant and uphold the highest standards of practice. Question 19. Performance analysis shows a registered drama therapist, RDT, is considering beginning a therapeutic relationship with a 15-year-old client who expresses a strong desire to engage in drama therapy. The RDT has met the client once for an initial consultation. What is the most ethically sound course of action for the RDT to take regarding consent and the commencement of therapy? Option A. Begin therapy immediately to capitalize on the client's current motivation, with the intention of obtaining consent from the guardian at a later date. Option B. Share the client's expressed interest and initial consultation details with the client's parents without direct consent to gauge their willingness to support therapy. Option C. Obtain written informed consent from both the minor client and their legal guardian, clearly outlining the nature of drama therapy, its goals, confidentiality limits, and the client's right to withdraw before commencing sessions. Option D. Proceed with therapy based on the minor client's expressed enthusiasm and perceived maturity, assuming their consent is sufficient given their age. Correct answer is C. Obtain written informed consent from both the minor client and their legal guardian, clearly outlining the nature of drama therapy, its goals, confidentiality limits, and the client's right to withdraw before commencing sessions. Explanation. This scenario presents a professional challenge due to the inherent power imbalance between a registered drama therapist, RDT, and a client, particularly when the client is a minor. The RDT must navigate the complexities of maintaining professional boundaries, ensuring client confidentiality, and obtaining appropriate consent, all while adhering to the ethical guidelines specific to the RDT profession. The RDT's dual role as a therapist and a potential recipient of personal information from a minor requires heightened vigilance. The correct approach prioritizes the client's well-being and autonomy within the therapeutic relationship, as mandated by RDT ethical guidelines. This involves a clear and documented process of obtaining informed consent from both the minor client and their legal guardian, ensuring they understand the nature of drama therapy, its limits, and their rights. The RDT must also maintain strict confidentiality, only disclosing information when legally or ethically required, and always with the client's or guardian's awareness where possible. This approach upholds the principles of beneficence, non-maleficence, and respect for autonomy, which are foundational to ethical practice in drama therapy. An incorrect approach that involves proceeding with therapy without explicit, documented consent from both the minor and their guardian would constitute a significant ethical failure. This violates the principle of informed consent, potentially exposing the RDT to legal repercussions, and more importantly, compromising the trust and safety of the therapeutic relationship. Another incorrect approach, such as sharing details of the minor's sessions with other adults without a clear therapeutic or legal justification and without proper consent, would breach confidentiality, a cornerstone of ethical practice. This action undermines the client's sense of security and could lead to significant harm. A third incorrect approach, assuming the minor's consent is sufficient without involving the legal guardian, disregards legal and ethical mandates regarding minors' participation in therapeutic services. Professionals should employ a decision-making framework that begins with identifying the ethical principles at play, consulting relevant RDT ethical codes, and any applicable legal statutes concerning minors and therapy. This involves a thorough assessment of the situation, including the client's age and capacity to understand, and a proactive approach to obtaining informed consent from all necessary parties. Open communication with the client and guardian, clear documentation of all consent processes, and ongoing reflection on the therapeutic relationship are crucial for maintaining ethical integrity. Question 20. Process analysis reveals that a registered drama therapist, RDT, is working with a client who is sharing a deeply personal and potentially traumatic narrative. The RDT notices parallels between the client's story and a significant personal experience from their own past. In this situation, which approach best upholds the RDT's ethical obligations and therapeutic responsibilities? Option A. The RDT interprets the client's narrative through the lens of their own theoretical framework without significant client input or validation. Option B. The RDT shares their own personal stories that mirror the client's situation to build rapport and demonstrate understanding. Option C. The RDT actively listens to the client's narrative, validates their experience, and uses open-ended questions to encourage further exploration of the client's own story and its meaning. Option D. The RDT steers the narrative towards a predetermined outcome or a specific type of resolution that aligns with the therapist's personal beliefs or desired therapeutic results. The correct answer is C. The RDT actively listens to the client's narrative, validates their experience, and uses open-ended questions to encourage further exploration of the client's own story and its meaning. Explanation. Scenario analysis. This scenario presents a professional challenge because a registered drama therapist, RDT, must navigate the ethical complexities of using personal narrative in a therapeutic setting, particularly when it involves potentially sensitive or triggering content for the client. The RDT must balance the therapeutic benefits of narrative exploration with the client's right to privacy, safety, and autonomy. The RDT's role is to facilitate the client's process, not to impose their own narrative or interpret the client's story through their own lived experiences in a way that could be misconstrued or harmful. Careful judgment is required to ensure the therapeutic alliance remains strong and the client feels safe and respected. Correct approach analysis. The correct approach involves the RDT actively listening to the client's narrative, validating their experience, and using open-ended questions to encourage further exploration of the client's own story and its meaning. This aligns with the RDT's ethical responsibility to prioritize the client's well-being and self-determination. By focusing on the client's internal experience and allowing them to lead the narrative, the RDT upholds principles of client-centered therapy and respects the boundaries of the therapeutic relationship. This approach ensures that the narrative work serves the client's therapeutic goals without imposing external interpretations or personal biases, thereby adhering to professional standards of practice that emphasize client autonomy and safety. Incorrect approaches analysis. One incorrect approach involves the RDT sharing their own personal stories that mirror the client's situation. This is a regulatory and ethical failure because it shifts the focus from the client to the therapist, potentially invalidating the client's unique experience and creating an inappropriate dual relationship. It can also lead to the client feeling responsible for the therapist's emotional well-being or feeling pressured to conform to the therapist's perceived experience, violating principles of client autonomy and professional boundaries. Another incorrect approach is for the RDT to interpret the client's narrative through the lens of their own theoretical framework, without sufficient client input or validation. While theoretical understanding is important, imposing interpretations without allowing the client to co-construct meaning can be disempowering and lead to misinterpretations that are not aligned with the client's lived reality. This can be seen as a failure to respect the client's narrative authority and can undermine the therapeutic process, potentially causing harm by misrepresenting the client's internal world. A third incorrect approach is for the RDT to steer the narrative towards a predetermined outcome or a specific type of resolution that aligns with the therapist's personal beliefs or desired therapeutic results. This is a significant ethical breach as it disregards the client's agency in their own healing journey. It can lead to the client feeling unheard, misunderstood, or forced into a narrative that does not resonate with them, thereby violating the core principles of client-centered care and potentially causing psychological distress. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough assessment of the client's needs and the therapeutic context. They must prioritize ethical guidelines, such as those established by the North American Drama Therapy Association, NADTA, which emphasize client welfare, autonomy, and confidentiality. When engaging with narrative, the RDT should adopt a stance of curiosity and active listening, using techniques that empower the client to explore their own story. This involves asking clarifying questions, reflecting back what has been heard, and inviting the client to elaborate or reframe their experiences. The RDT must continuously monitor the therapeutic alliance, ensuring that the client feels safe and supported, and be prepared to adjust their approach based on the client's responses and the evolving therapeutic dynamic. Self-awareness regarding personal biases and potential countertransference is crucial, and supervision or consultation should be sought when navigating complex ethical dilemmas.